Welcome to this clinical walkthrough on the epilepsy follow-up case for UKMLA, brought to you by Mediate, your 24/7 practice partner. So today, we're going to break down a super common follow-up station, the kind of thing you're almost guaranteed to see in your PLAB 2 or UKMLA OSCE. We've broken this down into 5 key parts. First, how to open the consultation. Then, the big one, assessing the actual problem. After that, we'll talk lifestyle factors using MF-TOSA, then pull it all together in a management plan, and finish up with some crucial safety advice. Let's get right into it. All right, section 1. Look, how you start any OSCE station is so important. This is all about making a good first impression, making sure you're talking to the right person, and setting a clear agenda for the appointment. So, let's break this down. It's polite, it's clear, and it creates a sense of partnership right away. And that last part, is that all right with you? That's you asking for consent. It shows respect, puts the patient in control, and it's a huge tick in the box for the examiners. Okay, let's dive into the real meat of the consultation, assessing the clinical problem. This is where you play detective and gather all the clues you need. The key is to be systematic so you don't miss anything. And this system is your best friend in the exam. It stops you from getting lost or forgetting something crucial. You start with the backstory, check what they understand, then you go hard on the medication history, review their current symptoms, and finally, you screen for any nasty complications. You always want to start broad. A question like this is perfect. It's open-ended, it lets the patient tell their story, and you get to hear exactly how this all started from their perspective. After they've told you their story, you need to check what they actually understand about their condition. You'd be surprised how many patients don't really get it. Having a simple, clear explanation like this with zero jargon is absolutely essential. And boom, here it is. This is almost always where you'll find the core issue, the medication history. In this case, you uncover a huge red flag. They were told to take it twice a day, but they've only been taking it once. This is likely the reason they're still having seizures. Now, your reaction here is being marked. You can't sound judgmental. You can't say, well, that's why it's not working. An empathetic phrase like this one is perfect. It shows you're on their side and that you're going to fix this as a team. Okay, so now you dig into the symptoms. You've got to ask these specific questions to figure out what's been going on. How often are the seizures happening? Are they getting worse? What triggers them? This gives you a baseline to work from. And please don't forget this part. Screening for injuries is non-negotiable. People can get seriously hurt during a seizure. Asking about head injuries or broken bones is a massive patient safety point. You have to ask. Speaking of getting this right, remember that you can practice this exact case right now and get objective feedback on Mediate.com. It's one thing to watch this, but it's another to actually do it yourself under pressure. All right, section 3, we're going to use a great little tool here to make sure we cover all the lifestyle stuff that could be impacting their epilepsy. It's the MF-TOSA mnemonic. It's a lifesaver for making sure your history taking is complete. You've already nailed the M for medical history, right? So now we're just going to quickly run through the rest. Alcohol intake, their functional and social life, any potential triggers, their occupation, and the big one for safety, driving. It's a fantastic checklist. For T, triggers. You have to think about the patient in front of you. In this scenario, he's a 20-year-old student. So what's relevant? Flashing lights at clubs, poor sleep from studying, in long hours in front of a screen. You see? You tailor your questions. Okay, you've gathered all your clues. Now it's time to put it all together into a solid management plan. And the goal here isn't just to tell them what to do. It's to make sure they understand why they're doing it. That's what gets you buy-in. This is how you explain it in plain English. You can say something like, think of it this way. When you only take the pill once a day, the medicine level in your body drops by the evening. And when that level is low, your brain is less protected, which is when seizures can sneak back in. Make sense, right? And here's how you deliver the instruction. Super clear, no room for confusion. You state the goal, a steady level of medication, and then you give the specific instruction. From now on, you'll take it twice a day, 1 in the morning and 1 in the evening. And this is what separates a good candidate from a great one. You're not just giving generic advice, you're tailoring it to this patient. He's a computer science student, so telling him to just use the computer less is useless. Give him practical solutions he can actually use. Okay, we're on the home stretch, but this part is absolutely critical. Safety advice. This is where you have to be really clear and direct about what they can and cannot do, and what to watch out for.
The patient mentioned a trip to Kenya to go mountain climbing. You have to shut that down, but politely, of course. You have to be firm and say that an activity like that is just too dangerous right now, and that it needs to wait until the seizures are completely controlled.
Now, when it comes to driving, you're not just giving medical advice, you're stating the law. You must inform them of the legal requirement. You need to tell them they must be seizure-free for 2 years before they can even think about driving. This is a non-negotiable point.
And finally, you safety net them about the medication itself. You're not trying to scare them, you're giving them the tools to look after themselves. Give them a short list of the common side effects to watch out for, and tell them who to call if they experience any.
And that's it. You've covered every base for this station. Now, the only thing left is to practice until it feels like second nature. You can practice this exact case now on mymediate.com.